Good afternoon, everyone. Welcome to Functionally Enlightened. Today's workshop is going to be going over stress and hormones. And what I like to start with is addressing why you might be here with us today. So, number one, you might have a health complaint and are not reaching your health goals. You have seen more than one practitioner, but they're just treating the symptoms, and the cost is becoming prohibitive. So you're not seeing enough success or enough improvement with these practitioners. You've tried a lot of things, but nothing has really worked. Your health problem is starting to interfere with your quality of life, and you're committed to natural health, but you're unhappy with the current progression, and you know that something is missing. It may not be entirely your fault. As of now, if you've seen multiple practitioners, you're probably caught in that cycle of trial and error, where you go to multiple doctor visits and they tell you either things are normal or abnormal, and they prescribe a set of prescriptions to treat what they see on a laboratory report. Otherwise, if there's some structural abnormalities, they might suggest surgery. So beyond that, you've probably had cycles of trial and error with natural remedies or things that you've seen on Instagram. Um, there's numerous health practitioners out there providing so many resources, but it's not very simple to just grab a resource and apply it to one's own chronic illness. So we could be in that cycle of trial and error with diet and exercise and supplements, additional therapies. And if that doesn't work and you take the focus off of diet, maybe you're going to focus primarily on supplementation and you'll do the exercise pieces and the diet and again, alternative therapies. But it's not really bioindividual to you and your needs. So it's not filling that needs gap. You ever heard everything looks normal? So if your blood work looks normal, does that mean that what you're feeling is all in your head? Are headaches and aspirin deficiency? Is fatigue caused by a caffeine deficiency? And is sleeplessness an ambient shortage? But we know that even those abnormal results on your labs are not the problem, but they're the result of the problem. And if we just treat those symptoms or we treat those lab values, we're still stuck in that cycle of trial and error. So, diet and exercise are critical components to any holistic healing protocol. It's critical, again, diet, but many people with chronic health complaints, they're already eating healthy and real foods, or they're already partaking in one of those fad diets, maybe invested in carnivore diet or veganism, and they still have these health complaints. Additionally, exercise is important. Movement is life, and it's mandatory to get that movement in on a daily basis. There are so many people who are active and fit, but they still feel unhealthy. You're committed to health again, but there's something missing. My history. For some of you who don't know me yet, I am an environmental engineer and now an FDNP. And in 2019, I underwent a hernia repair surgery that left me disabled. And essentially, the hernia repair was done with a mesh. And the mesh used was biosynthetic, but it caused such a severe inflammatory response in my body that my autonomic nervous system became damaged. And I had a myriad of symptoms. And that's what started my cycle of trial and error. I saw numerous specialists, numerous surgeons. I had an extract or an explant surgery about 4 months after the implant. And this is where I really started digging in deep because my health went from being able to run several miles a day, lifting weights, raising my children. I was an engineer in the field a lot of the time, to being severely disabled and even almost bedbound. So I worked with top alternative doctors and I ran tests on myself first and foremost to understand where I was having deficiencies or where there was some stress that needed to be kind of remediated, for lack of a better term. And I identified these things, started working on it systematically, and over the course of a year or two, started regaining more and more function. And that's where I pivoted from engineering into functional diagnostic nutrition. And I resolved to make this my foundation and make this the focus of my research now is to help people who are suffering with chronic illness having severe disability following a surgical procedure, and providing insight that things can be done to improve the quality of life. So from here, I ran hundreds of tests on men, women, and children. I made observations on who was getting better and who didn't. And I was able to develop what I call the point approach, which I'll discuss more in detail a little bit later on. And this method identifies that needs gap that I mentioned earlier so that we could figure out how to fill that gap and end that cycle of trial and error. So again, we don't chase symptoms or lab values. We understand that the root cause may never be known, but if we sort out the metabolic chaos and we figure out where the needs are, we can restore balance to the body. So just for you as a quick survey. So we probably, if you're here, you have experienced symptoms or two, one or two symptoms, maybe three or four, but I have here listed a series of symptoms that might be associated with chronic illness. It doesn't matter the diagnoses or it doesn't matter a specific, if we're looking at hormone imbalance, I just want you to take a look at this list of symptoms and in your head, or maybe you can jot it down. How many, if any, of these symptoms have you experienced in the last 6 months? So things from anxiety, headaches, sleep problems, fatigue and tiredness, irritability, neck tension. We call it the coat hanger pain. For people who experience the autonomic nervous system dysfunction, you have that pain that comes down the cervical spine and might radiate out towards the shoulders. Weight gain, weight loss, you name it. And think about which one of these bothers you the most. How long has it been going on? And how does it affect your life? Maybe your activities that you do on a daily basis, hobbies, your work, time with your family. How does it impair your attitude if it does? And does it limit the ability to exercise or any other duties that you have in life? Think about all those symptoms and possibly additional symptoms that aren't even listed here. If you could change one thing about your health, what would it be? Would you like to get rid of those problems? You can choose to raise your hands if you have experienced more than one, or if you've checked more than one of those boxes. Yeah. Yeah, I see. Yes, you're not alone. If you've had more than one symptom, that means that something is wrong. There is no normal symptom. And then these symptoms are not our enemies. They're really a warning sign that the body's breaking down. And if we don't do something to help the body, then things will likely get worse. So what I like to refer to as the automobile analogy. If your check engine light comes on, how long are you going to wait before you get it in for a checkup? Some people might wait a day or two, maybe three, but more than likely they're probably going to get it checked out because they know that that car will not be able to run efficiently unless it's optimally primed. So this leaves us with two options. You can either continue to do what you've always done with following fad diets or any specific diets that someone told you was the right one for you without proper testing, without proper clinical correlation. You can do the same exercises, maybe over or under stressing your body, taking a slew of supplements that you're just seeing this can help with this symptom and this can help with the other symptom, but not really knowing how it's impacting you specifically. Or you can decide today to make changes to improve your health. So my question to you today, if I could show you a way to rid yourself of the problems naturally and affordably, would you want to try it? So stress is the number one causal factor. In the Healthy and Natural Journal, it was reported that 70 to 80% of all doctor visits are for stress-related illnesses, and that people who experience high anxiety are 4 to 5 times more likely to have a fatal heart attack or a stroke. So 50% of all chronic illnesses are caused by stress. This is key. And stress, when we think of stress, we might be thinking of work-related stress, relationship stress, but there's so many different forms of stress out there, and we're going to go into each one of these. So the definition for stress is that stress in any influence, internal or external, causes or leads to malfunction. So the first one is mental, emotional, and spiritual. So this includes things like fear, worry, excitement, anxiety, relationships, existential angst, or lack of purpose, overtness, negative perceptions, and bad attitude. So, one of the most difficult things for me to understand was that our minds had significant impact on our healing. And if we were not able to start thinking positively, finding gratitude, being able to unplug from the stress of the world that we're facing every day, then our healing journey would either stagnate or stall altogether. With stress and with looking at the mental, emotional, spiritual piece, we want to think about brain retraining, and we might need a little assistance with that. So whether it be some type of therapies or certain programs like the Primal Trust, there's other programs like Gupta program, and I'm a huge fan of Brain Tap because this one allows me to literally unplug from everything. I close my eyes, I let the sound and the light therapy kind of take over for a longer period of time than I could on my own trying to do mindfulness practice. So, stress, again, mental, emotional, and spiritual. Next is physical trauma. Now, physical trauma accumulates over time and can manifest at any time or any place. This can also happen as an acute issue. So, we have trauma, micro trauma, and fractures would be more of an acute timeline, but it becomes chronic because it takes some time to heal. And if we don't take the right steps, then that fracture is going to either develop into a chronic pain or it might not heal correctly. So, beyond that, we have muscle injuries and weakness. This can be a result of a surgery, which limited mobility and muscles begin to atrophy. So, weakness can develop from there. Nerve compression, and in my case, I have nerve denervation from the abdominal wall or within the abdominal wall. That definitely is a physical trauma. Repetitive or positional injury. This can be related to the type of work you do. Intense and prolonged exercise. I know there's so many people out there that do CrossFit training or they're training for marathons, and that can be a very big stressor on the body over time. Poor posture is another one. Learning that there's certain muscles that we have to have engaged to have proper alignment. And with that proper alignment, there's so many signals that get sent from the brain to everywhere in the body that it needs to be. And if we have poor posture, then that can be hindered as well. And then accidents, you can group that in with any type of disease progression that leads to a required surgery or a mandatory surgery. So in my head, these are acute, but they also can create a chronic syndrome there. And we also have the chemical, biochemical, and functional stressors. Again, stress is well hidden and involves several layers of investigation. So our functional diagnostics can be a big help in this specific area. So if we're looking at this variation of stress, we're thinking things like inflammatory foods and additives, pesticides, herbicides, and GMOs, which are so like, amplified in today's world and in our grocery stores and in our farms, our conventional farming. We have alcohol, caffeine, and blood sugar dysregulation, prescription medications, recreational drugs, chemicals, metals, which are rampant, especially in my world where I developed implant illness and I work with a lot of people who have also developed implant illness. Can be from anything from hernia mesh, as in my case, breast implants, it's dental implants, they can be hip or joint replacements in general. All of these are metals. But beyond that, we're exposed to metals in through our soils, through our foods, through our water. So, municipal water does its best to remove those toxins, but it's not 100% efficient. And these toxins are bioaccumulating in our waterways. Eventually, we're ingesting it. So, furthermore, we have antibiotics and over-the-counter medicines, things like Tylenol, aspirin, ibuprofen. Those things really, really put a burden on our liver and can cause reduced stomach acid, which will impact our digestive systems, impact our ability to assimilate nutrients, and so forth. Exogenous hormones like synthetic birth control. Then we are also exposed to things like parasites, bacterial overgrowth, fungi, viruses. Sleep deprivation is a big one. A lot of people, I think, because of the age of technology that we're in, we are go, go, go until nighttime. We still have screens on or blue lights if we're not using our blue light blockers. It can hinder our ability to fall asleep and to produce melatonin. act appropriately so that we can get that deep rest that we need for that rest and repair mode, but also, waking up with stress already in our minds. There are so many things leading up to sleep that we might have all these mental lists and know that there's another day that's going to be full of things to do, check marks to check off our list. But it's a process to learn how to improve sleep hygiene. No exercise is another one. Again, a lot of us might be experiencing pain, chronic pain, and maybe we have a lot of mobility constraints based on either a disorder that we were born with or a disorder that we've developed over time. And then there's allergies. And this is a result of overactive immune systems. We're exposed to so many toxins. Things can start triggering us. Our histamine response, it causes additional inflammation and things like that. So overactive immune systems need to be looked at. It's great to have an immune system that functions, but there's also too high of activity with that. So instead of chasing the symptoms, what if there was a step-by-step assessment procedure that allows you to identify those underlying causes and conditions? What if you could see why you're doing so poorly right on a functional lab report and receive that validation along with a personalized natural protocol? You had a potent, proven, professional, drug-free program that can help you improve health instead of just treating the symptoms. And if money was no object, would you do it? So if this set of diagrams is a good way to look at how disease is now being represented. We have our brain-body connection here. There's multiple signals again being sent out from the brain, in the form of hormones and nutrients, immune response, and we also are dealing with our nerves and our energy flow. So specifically with the nervous system, because so many of us have been exposed in recent years to antigens or to some type of toxin load that has contributed to malfunction in the nervous system. And these are the somatic or autonomic processes that happen. Most people, when they're in good health, they don't have to think about breathing and they don't think about urination except for when they have the urge to go. They don't have to think about the heart rate. And all of these things should be working naturally so that we can do the physical things that we're supposed to be doing. With respect to the body, we have the brain sending the signals to all of our organ systems, our lungs, liver, heart, and adrenals, and they should be functioning well, right? Or very close to 100% functionality there. And when we are in this state of good health, we have a good vital reserve, and we're operating with plenty of ease. But when we start getting taxed, our systems are taxed with toxicity again, or with any of those stressors that we discussed earlier, we're going to start to experience certain symptoms. And instead of being in a state of ease, we now are in a state of disease. And that will definitely impact the vital reserve. So no longer are we able to function in a 100% functionality. We'll say there's a malfunction that needs to be addressed before it continues to spiral downward. That's what we call metabolic chaos. So metabolic chaos can be the cause and the result of itself, and it can contribute to additional dysfunctions of the organ systems. So a lot of people at this point will seek out relief care, and this comes in the form of either pills or surgeries. You go to your doctor and they prescribe you whatever it is. If you have a headache, or a migraine, they'll prescribe you migraine medications. If you have chronic pain, they'll prescribe you pain medications, or they'll suggest a pretty strong over-the-counter to address that. And another one that's common, if you have some nausea or you feel like you have acid reflux, they prescribe proton pump inhibitors, which actually is a big problem because it's doing the opposite of what we really need it to do. We don't want to turn down the acid because it's going to release the pressure, the ability for the sphincter to close up when it needs to. Symptoms, again, are a signal that something is wrong. No symptom is ever normal. So if somebody tells you it's just you aging, that's not correct. We're not supposed to develop symptoms like migraines and complete hormone dishevel, but we should be undertaking the aging process and trying to capitalize our vital reserves so that we can age more gracefully. And the word that is now being used for that is longevity. With relief care, oftentimes symptoms might go away or they decrease, but they may come back with a vengeance if the underlying situations are not addressed. So the paradigm now is to focus on resolving that metabolic chaos while providing some intelligent relief care. And we're not going to stop with just, oh, symptoms are seeming to ease. No, we're going to continue to build that vital reserve so that you can restore function there. So again, distress, when we're living with life with these symptoms now, whether it be mental or physical or biochemical, they're all impacting our body. So mental and emotional can be a perceived stress. Biochemical or traumas can be physical. And our chemical, biochemical, and in my world, environmental toxins are going to be contributing as a stressor and to our metabolic chaos. So as an FDN, we also look at corrective care. We identify healing opportunities, apply the wellness principles needed to restore function. And from here, the body can return to a state of ease and the health is restored. After that, our maintenance care can ensue because once we return to a state of good health, we don't want to fall back into old practices and allow chronic illness to regain a foothold. But we want to maintain our trajectory into healing. And so symptoms generally disappear, complaints become permanently resolved when you know the steps to take and to continue taking throughout life. So the term metabolic chaos, you may have recalled me saying a few times, it's a state where hidden stressors have caused malfunction, but the symptoms appear so far downstream that it's impossible to actually predict the root cause. And a clue to knowing that metabolic chaos should be the real diagnosis is when you're receiving intervention based on a traditionally reliable cluster of symptoms or even abnormal test results in your labs, and you only get a marginal response. So maybe a slight shift in the amount of headaches you're having weekly, or maybe some digestive relief when you take a certain pharmaceutical, but then it might return shortly after. So as I mentioned, contributors to metabolic chaos are the cause and the effect. When I explain the metabolic chaos cascade, this is a great depiction of what it is and what it can develop into. So the hidden stress and imbalances, if not soon resolved, they cascade into other areas. And the problem is the weak link. And if we don't address it, metabolic chaos will ensue and it causes serious dysfunction. And this leads to disease and prominent symptoms showing up. One diagnosis that we default to is metabolic chaos. The symptoms don't matter in the sense that we're not looking for a diagnosis or a root cause, but we do use this for clinical correlation along with some of the functional labs that I'll be discussing shortly. It may be undetectable and so far removed that we never can identify the single root cause, but you can have a positive effect upon it when you know what steps to take. So with 3 easy steps to resolving metabolic chaos, we can begin by assessing the underlying conditions and the contributors to the metabolic chaos. So we do this by means of a comprehensive onboarding, which includes careful history and pulling from all the different organ systems that can be impacted. But we also track this over time, along with the lab investigations. Then step 2 is to customize the Dress for Health Success program. And for you, it could be very bioindividual, very holistic. And what I've developed is the point approach, which we'll talk about in just a few moments, but it includes all of those things that are so critical, the nutrition, the optimizing movement, identifying those stressors, nurturing sleep, and targeted therapies. So we'll run the program with you, providing health coaching services. But the main intents are to coach up function and coach down the contributors to metabolic chaos. Correct course as needed because we are continuously being exposed to all of these toxins. There might be other scenarios that pop up in your life. So there's a way to correct for that as you go. We can't just default into one single protocol and think that that will get us from point A all the way to the end of our lives. But we will course correct as needed. And underlying causes are resolved. So the vital voids are revealed through our clinical correlation along with the lab investigation, and we figure out what really needs to be fixed. How we work, we run functional lab assessments to identify those malfunctions and healing opportunities within the hormone, immune, digestion, detoxification, energy production, and nervous systems. And we also look at oxidative stress. So hidden is the acronym that is used to symbolize these systems. And these are the internal stressors and dysfunctions which highly correlate with the most common chronic health complaints. So in looking at the first set of labs, the HPA hormone and stress profile, this is a pivotal piece because it assesses the hypothalamus pituitary adrenal axis, and that is HPA. It can take a look at the cortisol awakening response. It'll give us some insights on adrenal dysregulation, circadian rhythm disorders. It also takes a really good look at the sex hormones and any immune system issues. So some of the markers included in this panel include cortisol and DHEA. It includes estrogens, progesterone, testosterone, and melatonin. And from here, we're able to get a snapshot of the overall vital reserve and look at the multiple healing opportunities with this lab alone. So this one will help us to guide the therapy, and it points to other areas of investigation. And basically it's the baseline to monitor the changes. But the hormones themselves are not the problem, right? They're the result of the problem. Now, this is an example of one of my clients, and you can see there's three lines on this graph. And the first two here are actually test one, and the light blue one here is test two. The green line depicts a baseline. This is where a good cortisol response line would be. And you can see on the first test how much higher the cortisol in the AM was. It was off the chart. And when somebody's waking up with cortisol this high, you can think about all the things that could be happening, whether it's blood sugar dysregulation during the night, whether they might have had too many drinks. When somebody wakes up with high cortisol like this, we think about the stresses leading up to bedtime, or maybe even their alarm clocks could be causing a stress if they wake up in that panic mode and they start the ruminating thoughts of all their to-do lists. It could be blood sugar dysregulation, something they ate maybe the night prior, maybe something very heavy in carbs, and then all the other things. It can be parasites, some gut health issues going on. And so that's why we combine this with other set of labs to see what else could be a hidden stressor. Now, there's also a Dutch test that I often use when it's something that needs a deeper dive into the methylation pathways, and maybe we're looking at the adrenals a little bit deeper. For instance, if there's a client that's dealing with fertility issues, this would be an ideal test to take a deeper look at how everything is metabolizing in the body. Another one is the metabolic wellness profile. This one is key for identifying dysfunction in the digestive system. So it includes indican, total bile acids, and 8-OHDG, which is a measure of oxidative stress. And so if we look at indican by itself, this tells us there might be an issue with protein absorption or digestion. And then the urinary bile acids might give us an indication of an insufficiency of digestive enzymes, or it might give us some insight into liver congestion. For instance, if it was very high, we know that the bile acids are backing up in the system. And it identifies multiple healing opportunities, providing, again, a direct measure of liver congestion and providing deeper insights. But is maldigestion and poor detoxification the problem, or is it the result of the problem? Must go on. I look at all of these labs together. These are my foundational labs. And so the client that I showed you for the stress and hormone panel also is presented here with a metabolic wellness profile. And we see very high indican, very low total bile acids, and moderate, like borderline 8-OHDG. So in my head, I can already start to deduce that there's some protein absorption issues. So inability to break down these amino acids that we need. Total bile acids, we're not able to produce what we need for proper digestion. And then 8-OHDG being over there borderline is showing me that there is some potential DNA damage going on and that the oxidative stress is a little bit high and we need to work on antioxidants. So here is another example where the same scenario, except we have very high indican. Our total bile acids now are borderline. So here they're moderate, but ideally we want it in this second quintile. We want it in this green. So we know that the bile acids here are trending high, and that might point a little bit more to liver congestion. And finally, we have some oxidative stress happening here again. We want to bring that stress down. The next lab is the mucosal barrier assessment. Not to go into it too deeply, I have given a couple of lectures on this topic and they are available on our YouTube channel. They're available on our website. So if you're interested in learning a little bit more, we can provide those links. So with zonulin, histamine, and diamine oxidase, which is the DAO, these things give us a good picture of the state of the gut in terms of term that you might have heard before is leaky gut. So we know zonulin, if it's present, if it's present enough to be shown in these labs, that leaky gut is an issue. And histamine, again, if we're having antigens or any of these pathogens that are in our body, this histamine is going to try to encapsulate it. So we get higher and higher levels of histamine, where DAO comes in to try to break down that histamine bubble and try to flush it out of our system. So we need a good balance of the DAO to histamine. And that's why that marker is pretty pivotal. We want to make sure that, yes, we have that histamine response. It's essential for proper elimination, but we need to have the enzyme to break it down and get it out and out of our systems. So again, more information can be provided on that in a different forum. So here is the same client. We're following that person through all of the labs, and we see zonulin being elevated. It's pretty much trending on the red, which in my head, I'm already knowing that leaky gut is a problem. These tight junctions are staying open for, throughout the digestive tract, which is increasing that zonulin. Then histamine here, again, trending high. DAO is, you look at the scale here, it's reversed. So actually it's trending low, where the left side of the scale shows higher. And then the ratio, which gives us a better understanding of that. So our histamine to DAO ratio here is trending high. We want to make sure that we have ample enzymes to break down histamine and to flush it out with that zonulin, the family peptide there. And then we have the GI pathogen screening. So this one will assess bacterial, parasitic, and fungal overgrowth. It'll give us a lot of information in intestinal health. And it's a PCR test, so a DNA test. And it even can give us information for diagnostic testing, but as a functional diagnostic nutrition, we don't diagnose specific diseases. But this is something that medical doctors do use for diagnosing. And so it identifies pathogens and biofilms that might be interfering with healthy function, and that could be a big big block against your healing journey. And here's our client again. This is the GI pathogen screening results. And these are commensal or keystone bacteria. So the good guys, we can call them the good guys, but we want a good population of these. And when I see things trending on the low end, I'm thinking there's an insufficiency of these commensal bacteria. And especially when I look here at the bacteroidetes, and the Firmicutes, both of these are actually on the lower end. And those two families comprise about 90% of the microbiome. When you see them low, you definitely can think of an insufficiency there. And so there needs to be a building of this microbiome. Many other markers are provided on the GI pathogen screening, but for sake of time, I'll just briefly show the intestinal health markers here. Steatocrit and elastase at the top. Steatocrit is a marker that shows fat digestion. And so in this client's case, there's not an issue with the ability to break down fat. I would make sure that I would have that clinical correlation to see if they are taking in fat to begin with, because some people are on a very low fat diet. And not to get into that, but healthy fats are essential to building hormones. So we want to make sure that it's not a matter of them not ingesting it, but that they're able to digest it. So elastase here, this will point to pancreatic issues. So in this case, it's low. And so there's a pancreatic insufficiency. And there needs to be a shift in the microbiome again. Maybe some supports would be needed in the form of digestive enzymes. We have other markers here. Beta glucuronidase would point to, again, stagnation or liver congestion if it was trending high. In this case, it's in a good range. I just would want to keep an eye on it. It could also point to hormonal imbalances again, because the liver is pivotal in helping to clear those estrogens, the old estrogens. So I would correlate that with the initial diagnostic test that we talked about, the stress and hormone profile. Occult blood, sometimes this will show up and you would have to dig in deeper and make sure that the person isn't having digestive issues such as hemorrhoids, or maybe they've had a recent surgery. But definitely if it shows up in a high range, this is something that the client would take to their doctor to get addressed. And then we have things like the secretory IgA, which is an immune marker. In this case, very high. So there must be some type of active infection going on, some type of pathogenic load. Anti-gliadin would tell us if there's some type of gluten reactivity. Now, the thing is, if it's high, it will definitely point to some immune response to gliadin. But this is only one specific test for it. And we know that there's different proteins in wheat. So it doesn't automatically say you don't have an issue with gluten. This is just, again, one of the markers, and there would need to be a deeper dive into that one specifically. All right, and then we have two other inflammatory markers, calprotectin and the eosinophil activation protein. So both of these are in a good range for that client. Lastly, we have food sensitivity testing, which my favorite is the MRT, the mediated release test, because in this particular food sensitivity testing, we don't have to challenge ourselves by eating foods that we might not have been eating due to sensitivities or due to some type of responses that we were feeling, symptoms. Maybe we get gas or bloating or mast cell flares, things like that. So I like this test because it's a whole blood test and you don't have to, again, challenge by eating or consuming these foods. And so when items or foods show up on the MRT, you want to try to avoid consuming them for up to 3 months, maybe longer, and then you reintroduce them one at a time. So it's not ideal to stay on an elimination diet. We want diverse foods. We want to enjoy eating our foods. But I myself was limited to probably about 5 or 6 ingredients at some point, and I couldn't pinpoint which ones were the triggers and which combination, because sometimes it's a combination based on the amount of a specific food that you're eating. So the MRT is a really good option to identify which ones are triggering the immune response through the whole blood testing. So here's our client. We can see here, the green is pretty low reactivity, yellow is moderate reactivity, and then there's red, that would be high reactivity. So I only put a screenshot of some of the chemicals and some of the vegetables, but there are multiple pages to this report. And from here, we can see the client was reacted to caffeine, solanine, MSG, tyramine. And this client was taking in a lot of coffee, like 1 to 2 cups of coffee a day. Maybe some of you don't consider that a lot, but that she realized that she needed to cut out the coffee at that point. And then the same with the vegetables. There's some high histamine vegetables here, which kind of correlates with that mucosal barrier assessment we have, especially spinach. If she's showing reaction here, then it correlates to that histamine reactivity. And then a later test shows an improvement. It's a marked improvement here no longer sensitive to the caffeine, for instance. MSG is still showing up here, spinach is still showing up here. And so we want to see that immune response kind of dampening in terms of, the gut health and what is coming through our system, what is being assimilated into our body through our nutrition. So you can identify these healing opportunities and apply the wellness principles. When we talked about all those systems, we're looking at HPA axis and adrenal dysfunction, cortisol dysregulation, the circadian rhythm problems, hormone dynamics and imbalances, and so forth. So in step 2, we look to dress for health success. And that is our program where we look at individual components of diet, rest, exercise, stress reduction, and proper supplementation. We'll address the questions at a later time. So diet, rest, exercise, stress reduction, and supplementation. So that was a process so effective that FDN was granted a trademark by the USPTO. And it is exclusive to all FDN practitioners. As we apply these wellness principles, we are coaching up the vital reserve through the dress protocols and coaching down metabolic chaos. Step 3 is to adopt the dress program. So everyone's different. We have to go through 3 phases of care. First, relief phase, then corrective phase, and then maintenance phase. We start with the weakest area and get it going so that we can guide course correction as needed and provide feedback and accountability through the process. In the future, retesting might be necessary, but we identify all of these things and make progress as we go, touching in, checking for that metabolic chaos and seeing how everything is being resolved. So FDN works because of the sound principles. We don't diagnose, don't treat, but we make observations about metabolic chaos and we remove as many contributors and stressors as possible. We nurture and restore those functions and support weak links that are part of the metabolic chaos so you invariably get better. You want to help so you can help yourself. Modern medicine has no answers for building health. Even functional medicine practitioners and many health coaches are just treating symptoms or paper instead of the person. You want to have the tools and methods to figure out what's really wrong and take the power back into your hands. You learn the process that needs to be completed to keep you in optimal health, and you can take it into your own hands so you don't have to rely on the medical practitioners. So you become confident, especially when you see the results. So you have 2 choices. Number 1 is opt into the self-care model, as we have explained with the dress protocol, or you're forced into disease care. And which option would you choose? We don't want that cycle of trial and error. We don't want to have a decline in our health consistently. We want to improve our function. So I have a gift that I would like to give. And there's 4 reasons to accept the gift. Because number 1, your health problems may get worse over time if not treated. You feel great if you improve your health and eliminate your symptoms. Isn't feeling great what life is really about? Number 3, I'm not going to waste your time or money. If I can't help you, I'll let you know, and I'll refer you to someone who can. And 4, you have nothing to lose because I'm going to do a free consultation for you and an initial screening at absolutely no charge. So to indicate you would like a free consultation, please let us know in the chat or send us an email at info@functionallyenlightened.com. And again, I appreciate you for attending our webinar today. Any questions you have, please feel free to send us an email as well. In terms of the questions that have been submitted in the chat, I will include them in the recording, and we will provide responses to each question if they pertain to our workshop today. Thank you again for joining us. Take care.